So I just want to comment on our process here a little bit in that you talked a little bit about your childhood, and I know reflection on how your emotional landscape developed from your childhood seems like it's been fruitful to you. I know that you've worked on expanding your emotional vocabulary. You have some different skills. How does the therapy process, how do you understand the therapy process, especially from like a CBT perspective? Because I would identify as a cognitive behavioral therapist.
Hmm. Well, I think one big thing that's been helpful about this, I think for a long time I had some perfectionism and some misconceptions about like what therapy was for, or at the very least I had some expectations that might not have been all that fruitful. And so, in other words, I remember seeing therapists early on, and they'd ask questions about childhood and things like this, and I expected, and I don't think pop culture has helped out much with this, but I expected that what happens in therapy is you eventually discover the thing, and then things are better. And the thing I like about the kind of therapy that I've been doing with you is that it's really more about you're not trying to uncover some like big explanation, I guess, in terms of how your past, just all of that. What you're trying to do is basically develop skills, regardless of sort of what may have happened in the past, or even kind of what's going on right now. Those skills actually, do you I think some modalities get it backwards, where you go back and you try to look at all these traumatic events and things like that without the skills. Whereas now that I've got skills, it's a lot easier actually to reflect about my past and about my present. If that makes sense. Like having the skills. Like I really feel like some of that childhood therapy stuff is probably not a place to start, but is probably a place to finish.
Really well said. Can you expand on that?
Well, just going back to the example from before. I mean, if bringing up memories and things like that, and just thinking about your childhood and your family and culture of origin, it's like that's going to bring up a lot of fear, and it's going to bring up a lot of sadness. And if you can't even identify those emotions and process them and be able to sit with them and realize that it's not the end of the world if you feel sad for a couple minutes or scared for a little while. I think that makes it a lot more helpful to then think more deeply about kind of issues of identity and how did I get here, and who am I, and what do I value, and things like that. So that was I spent a lot of years trying to go through that kind of therapy without really having the tools to even deal with some of the content that was coming up.
Okay. And can you tell me more about the tools, the skills, and the homework? Like what do you see as the skills and how you got there?
Yeah, that's another great example. It's like, I did some CBT before that had some homework, had more homework, and I would always feel really bad about not being able to complete it. And
Give me an example.
Like I'm going to, only spend 2 hours max on social media every day this week, and then failing it. And if I fail, so it'd be fine. I'd do it for one day, another day, but then if I failed, it was kind of all or nothing, and it was, it felt like I'd feel really bad about it, basically. But at that point in time, I didn't even have the concept of perfectionism, like clinical perfectionism. I kind of felt, I think I felt ashamed that I wasn't able to succeed, and I didn't kind of know some of the mechanisms around perfectionism and things like that were driving that feeling of shame and failure, and I think that impeded my progress a whole bunch, because every week I felt like I was kind of secretly failing alone, and that I couldn't talk about it that much in therapy for some reason.
Can you explore that a little bit? Why do you think you were secretly
Yeah. No, I mean,
feeling alone?
I think that's kind of the mechanism of shame, right? Is that, yeah, no, I could have brought it up in therapy, but for some reason I felt like I couldn't. And that reason is that's what shame does, right? It kind of makes you want to isolate and not share the fact that you feel shame. So it would have been nice to have known those skills before I even started to do homeworks. Like I think there should be like a FAQ or a set of caveats that like, hey, doing any homework at all, you might feel this way if you don't succeed, and that's probably just perfectionism or there are significant caveats around doing homework that I don't think are laid out to people that are going to do homework, and you don't discuss the homework kind of meta process by default enough in therapy.
It's a great point. There's actually literature around that the one of the biggest reasons that people drop out of therapy, and especially exposure and response therapy for anxiety disorders, or also known as experiments, is that there isn't enough prep around why you're doing the exposure in the first place, and then also what you can expect while it's occurring. So if you're assuming that going into cognitive behavioral therapy, what's happening is that you're experiencing anxiety, you're avoiding in response, that's creating, maintaining, and intensifying your suffering. So what you got to do is go find like a therapy coach, basically, that is going to teach you how to do exposure, teach you to do the response prevention. All you have to do is do the homework perfectly, and then you're not going to have your anxiety anymore. Is that actually some version of what you were thinking when you started therapy?
Yeah. Hmm.
So, and even though theoretically that ideally could be the process, for most people, what happens as they start to do exposure is all their beliefs show up. So beliefs about needing to do it perfectly, or feelings of guilt because they have inflated responsibility of what it means to go towards whatever is anxiety provoking. They might have negative belief, like core beliefs about not being worthy or being hopeless or helpless, that suddenly pop up as they try to go towards whatever they're afraid of. So from my perspective, that's all part of the process. And shame, like you said, lots of people feel shame when they try to do something that's challenging or that they're not able to do perfectly. So from my perspective, that is what therapy is, that in the context of a safe and supportive relationship, you try out something new, and then you see what types of thoughts and feelings show up, and then you work to get more flexible around those thoughts and feelings, and then you modify the exposure so that you target the thoughts and feelings that continue to cause you suffering. But sometimes that part of the process is either not explained or minimized, or something like that. Do you have thoughts about that?
Yeah. No, I think it's an interesting thing. You come in. I feel like maybe for a lot of people, when you're in therapy, the expectation is you're going to discuss things that are going on in your life, um, with someone, and that's kind of the main point of departure. But actually, therapy is something that's going on in your life, right? And when you first start, like the thing that brings you to therapy is, it might be acute enough. Maybe you're having panic attacks or something, but it might be acute enough that that's not the issue that you talk about. But I do think that at some point in the journey for a lot of people, that actually kind of breaking the fourth wall and having therapy about how therapy is making you, like having a discussion about how therapy is making you feel. In other words, that's a big part of your life too, and you're probably having reactions to that, and you're probably having content around that. We do that sometimes in the groups with you. You'll ask every now and then, like, has anybody ever felt? Has anybody ever done post? Has anybody ever done kind of post-event processing about one of the sessions here itself? I think that stuff's really good. Like the meta is way underdone.
What's helpful about that from your perspective?
Well, especially with people who are anxious and maybe potentially have some perfectionism, emotional perfectionism, especially like the therapy process itself can become a source of content, I think, fairly easily. But there's this and maybe it's cultural, but yeah, you never see anyone in movies talking to their therapist about the therapy itself. They're always talking about, their childhood or something like that. So, um, I, given that it's easy to become perfectionistic about the therapy process itself, it's kind of important to be open to the idea that therapy is not some sacred ground where you can't acknowledge that where it's not allowed for you to acknowledge that you're in therapy, and that itself is a process, just all of this.
Yeah.
Yeah.
And I would even expand on that, that's a perfect microcosm of what's probably going on in a person's life.
Right.
So feeling like you've got to do anything and everything perfectly, including the thing of trying to get better,
Right.
is usually or one of the reasons that people come in the first place. So if you can learn to talk about if you can get language around what's happening, talk about what's happening, and then be more flexible in your approach and be willing to take risks and be imperfect and sit with all the feelings that show up as you're doing it imperfectly, then you are starting to have the skills to be able to do that in other areas of your life too.